What to expect when you're expecting, part 2. So the second trimester is when everyone says you should be glowing, but it's not always the reality. For many people, the second trimester feels like a bit of a shift. So your energy might come back, your nausea may ease, and your bump starts becoming a little bit visible. This is also when people start feeling baby move for the first time, so them tiny little flutters or bubbles or like little taps inside your uterus, which can feel incredibly emotional. And for some parents, this is the moment pregnancy finally starts to feel real. But emotionally, the second trimester can still be overwhelming. You may feel anxious before scans, struggle with body changes, feel pressure to enjoy pregnancy, or suddenly realise like, oh wow, this baby is actually coming. And physically, new symptoms may appear too. So you might have pelvic pain or round ligament pain, heartburn, backache, constipation, difficulty sleeping. And this is usually when the mental load starts increasing too. So people begin asking questions about your birth plan, feeding choices, where you'll give birth, pain relief, and sometimes it can feel like everyone suddenly has an opinion about your pregnancy. And medically, this trimester often includes the anatomy scan, glucose testing, sometimes extra monitoring or growth scans. And this is also when intervention conversations can slowly begin creeping in. So you may hear things like, keep an eye on baby's growth, you may need an induction later, we'll monitor things closely. And again, while some recommendations are genuinely important, you still deserve balanced information, not just fear. And you are always allowed to ask, is this policy or medical necessity? What evidence supports this? What are my options? Can I take time to decide? Because pregnancy care should support your confidence, not take it away. And this trimester, usually when we do most of our sessions together, so we spend a lot of time really talking about what matters to you, your hopes, your fears, helping you feel informed and confident going into labour. A huge part of that is birth education too, so understanding what will actually be happening to your body during labour and why, because I honestly think understanding birth physiology is one of the biggest things that can help women relax into labour rather than fight against the sensations when they arrive. So when you understand why contractions build, what your hormones are doing, and how your body and baby work together during labour, it can make birth feel far less frightening and far more instinctive. It's also such a good time to start practicing hypnobirthing techniques. The more you practice the breathing, relaxation and mindset side of things now, the more natural it can start to feel when labour begins. And I always like to include birth partners in these conversations too, so they feel prepared and confident in how to support you.